Sarah watched silently as Dr. Matthews belittled her medical suggestion in front of the elderly patient. The surgeon's dismissive smile made her face burn with humiliation as she continued preparing the examination area. 3 days later, when the hospital staff gathered for a routine meeting, the elderly patient's unexpected presence and revelation of his true identity made the entire room fall dead silent. At Westside Medical Center, there was an unspoken hierarchy that everyone understood. At the top of that pyramid stood Dr. Richard Matthews, a 45-year-old surgeon whose reputation preceded him down every corridor of the hospital. His surgical skills were undeniably brilliant, his hands steady, his decisions quick and precise. But alongside his medical prowess came a personality that left much to be desired. Staff members would exchange knowing glances whenever they heard his footsteps approaching. Some would even find reasons to be elsewhere, ducking into supply closets or patient rooms to avoid his path. It wasn't that Dr. Matthews was cruel exactly. He was particular, demanding, and completely unwilling to entertain any challenge to his authority. The newest addition to his surgical team was Sarah Johnson, a 32-year-old nurse with 8 years of experience under her belt. Sarah had transferred to Westside from a smaller community hospital 3 months earlier, bringing with her impressive credentials and a reputation for maintaining composure, even in the most chaotic situations. During her orientation, several colleagues had pulled her aside with the same warning. Working with Dr. Matthews would test her patience like nothing else. Sarah had nodded politely at these warnings, but wasn't particularly concerned or worried about them. That Tuesday morning began like any other. Sarah arrived at 6:30 a.m., reviewed her patient assignments, and prepared examination rooms for the morning consultations. Her third patient of the day was William Grant, a 78-year-old gentleman seeking relief from arthritis that had plagued him for years. While taking his vitals, Sarah maintained a professional yet warm demeanor. She asked about his pain levels and how the arthritis was affecting his daily activities. Mr. Grant responded with brief, straightforward answers, his focus clearly on getting proper treatment rather than making small talk. When Sarah measured his blood pressure, her brow furrowed slightly. The reading was elevated, not dangerously so, but enough to warrant attention, especially for a man of his age. She noted the numbers on his chart and made a mental note to bring this to Dr. Matthews' attention. 10 minutes later, Dr. Matthews swept into the examination room with his usual air of authority. He barely acknowledged Sarah's presence as he picked up Mr. Grant's chart and began reviewing it. This was the moment Sarah decided to speak up about what she had observed. She informed Dr. Matthews that Mr. Grant's blood pressure was slightly elevated compared to his previous visit, suggesting they might need to adjust his current medication regimen. It was a straightforward clinical observation, the kind nurses make countless times each day. The change in Dr. Matthews' demeanor was immediate and chilling. He looked up from the chart, his eyes narrowing as he focused on Sarah. With a sharp tone that cut through the room, Dr. Matthews addressed Sarah, not minding the patient sitting right in front of him. He told her that if he wanted her medical opinion, he would have asked for it. He emphasized that her job was simply to take measurements, not make diagnoses, a skill that required actual medical school training, which he pointedly mentioned she clearly hadn't received. The humiliation burned across Sarah's face, though her expression remained professionally neutral. Dr. Matthews wasn't finished. As he turned his attention to Mr. Grant, his manner transformed completely. His voice became pleasant, almost jovial, as he remarked to the elderly patient that some staff needed to remember their place in the medical hierarchy. He presented this comment as if sharing an inside joke between equals, assuming the elderly patient would naturally align with his perspective. Mr. Grant said very little during the examination. He answered the doctor's questions about his symptoms and nodded at appropriate intervals. After Dr. Matthews finished writing the prescription and left the room, the atmosphere shifted subtly. Sarah helped Mr. Grant gather his items and his prescription as he prepared to leave. Suddenly, she asked how long she had been working at Westside Medical Center. Sarah responded that she had only been there for 3 months, her voice steady despite the lingering sting of her earlier humiliation. Mr. Grant's next question came softly but directly. He wanted to know if Dr. Matthews typically behaved that way with the nursing staff. Sarah hesitated. Complaining about a physician to a patient would be unprofessional, regardless of how justified her grievance might be. She carefully chose her words, stating that Dr. Matthews had high standards for his team and was an excellent surgeon. She left unspoken all the things she could have said about his behavior. Mr. Grant nodded thoughtfully at her diplomatic response but said nothing more. He thanked her for her assistance, collected his prescription, and left. The incident might have faded into the background of Sarah's daily challenges, just another difficult moment in a profession filled with them. But 2 days later, an unexpected meeting was called for all hospital staff, and attendance was mandatory. When Sarah arrived at the hospital's main conference room, the atmosphere felt unusually tense. The hospital administrator began the meeting with routine announcements, but everyone could sense these were merely a preamble to something more significant. After several minutes, the side door opened, and William Grant entered the room. Many of the staff, including Sarah, recognized him immediately as the elderly patient from earlier that week. But the administrator wasn't introducing him as a patient. Instead, he presented Mr. Grant as the man who had just finalized his position as the hospital's new board chairman and largest financial benefactor. The room fell into stunned silence as recognition dawned across faces throughout the audience. Several people shifted uncomfortably in their seats, while others exchanged wide-eyed glances. Standing on the podium, Mr. Grant explained that he had been born in this very city, but had built his considerable fortune abroad. Following the death of his wife the previous year, he had returned to his hometown and begun quietly assessing the hospital that already bore his family's name on its cancer wing. What the staff didn't know was that William Grant's late wife, Eleanor, had been a nurse for 40 years. During their time abroad, she had endured persistent disrespect and discrimination throughout her career. The challenges and humiliation she faced as a nurse had severely affected her self-esteem and mental health. Mr. Grant's voice grew more solemn as he revealed that after Eleanor's passing, he had made a promise to address such issues in healthcare facilities, beginning with this hospital where his family already had deep connections. His gaze swept deliberately across the room until it found Dr. Matthews in the crowd. Without raising his voice or changing his measured tone, Mr. Grant stated that during his visit as a patient, he had experienced firsthand how some medical professionals in this hospital treated their colleagues. With quiet authority, he declared that such behavior would stop immediately. Most surprisingly to the staff, the hospital board of directors issued a formal query against Dr. Matthews regarding his conduct, a decision that sent shockwaves through the hospital hierarchy. When the query was announced, the board made it clear that the action wasn't about a single incident. It was about setting a precedent and ending a culture of intimidation that had been allowed to flourish for far too long. Mr. Grant also took the opportunity to publicly acknowledge Nurse Johnson for enduring humiliation while diligently performing her duties. To further recognize her professionalism, he appointed Sarah to a newly created nursing advisory board that would give nurses a genuine voice in hospital operations moving forward. For Sarah Johnson, the experience became an unexpected turning point in her career. What had begun as another difficult day with a challenging physician had transformed into an opportunity to help reshape the culture of an entire institution. And you, what would you do if you witnessed workplace disrespect while in a position of power to change it?